Welcome, and thank you for taking the time to watch this meaningful use demonstration on how to achieve the core and menu measures. This video demonstration will cover menu measure number 6, Patient-Specific Education Resources. Let's get started. First, let's open up the PDF from the MTBC website for Patient-Specific Education Resources. This is the Eligible Professional Meaningful Use menu measure number 6 out of 10, Patient Education Resources. Use the certified EHR technology to identify patient-specific education resources and provide those resources to the patient if appropriate. The measure here is to provide this material to more than 10% of all unique patients seen by the eligible professional during the 90-day reporting period, and there are no exclusions. Let's scroll down a little bit and review our definition of terms and the attestation requirements. So a patient-specific education resource is something that's built into the EHR and allows you to provide specific material to the patient based on their condition or medication or tests that they might have performed. And of course, again, we see this concept of the unique patient. If a patient is seen more than once during your 90-day period, they're only counted one time. The attestation requirements for this measure include numerator and denominator, the denominator being the total number of unique patients seen during the reporting period, and the numerator being the number of patients in that denominator who've been provided patient-specific education resources. And again, you must provide that material to more than 10% in order to meet this requirement. Now here in the additional information section, the certified EHR technology is certified to use either the patient's problem list, medication list, or lab test results to identify those patient-specific education resources. And the education resources do not have to be stored inside the software. They can come from an external source. And we'll talk about how that's delivered from the EHR. And as always, it's the provider's discretion what type of material is provided to the patient and what you consider as relevant for that specific visit. So let's go into the EMR and take a look at the type of education material that's available in the EHR. When we have a patient's account open in the EHR, there's a section on the patient's record that's called Education. When we click into the Education section, we can go into the ADAM Illustrated Health Encyclopedia. Here we can use a resource that has more than 6,000 articles and illustrations that allow us to generate education material for diseases, injuries, special topics, surgeries, symptoms, and tests. So here, let's put in a specific item and see what type of results ADAM provides back to us. If I want to find education material for asthma, I simply type asthma into my search and I have a series of options that are available, including asthma, asthma pediatric, occupational asthma, and so on. I find the item that I'm looking for and I click into it. Here it gives me a definition, alternative names, causes, symptoms, emergency symptoms, exams and tests, treatment options, and support group information, as well as outlook, possible complications, and when to contact a medical professional. Additionally, there are some excellent illustrations that are included that you can print and provide to your patients. You also have the ability to save and print this option, save it, and in a next release of the EMR, you'll have the ability to upload this directly to the patient's PHR. You can also search for many other items, including things by diagnosis code. So if I search for code 250, I'll find diabetes results, and I can go learn more about diabetes. There are also hyperlinks inside the articles that can take you to more specific topics. This is one of the many types of patient education material that can be provided through the EHR. There are also education resources for medications. If we go into a patient's clinical record and we go over to the plan of care and we want to prescribe a medication, we can provide education material for any drug that we select. By clicking on this drug education button, we can open up some excellent drug education material that can be provided to this patient. This will also be documented in the patient's record that she has been provided drug education material on Lipitor and disease education material on diabetes.